Live everywhere.
Daily Co's Radio on netrootsradio.com presents
David Walton. Kagro in the Morning Show. Now, here's David Waldman.
Here I am. Hey, how you doing, everybody? It is Friday, July 10th, 2020. 7/10/2020. Yeah, okay, not too much there. For those of you who tune into the show just to get your lottery numbers, we are done, and I don't really have any great recommendations for you. Interesting that there's some round numbers there. There's some round numbers in our coronavirus reporting charts as well. Let's see, shall we wake you up to the reality, or do you already know? There are some people who haven't been paying attention, and they may not know that we are past our, 3.2, I guess we're now at 3.25 million cases here in the United States, and, I've got lots of news for you on that front. I clicked on something related to coronavirus here just a second, and guess what happened? I was clicking on a story on the Boston Globe, and guess what? I've been selected for only $1 for 6 months. I don't know why they phrase it that way, but I think what they're trying to tell me here is for $1, I'll get 6 months of subscription to the Boston Globe. I wasn't really looking for that, but I got selected. So, I don't want to look a gift horse in the mouth here. But I was actually trying to click through to a story about Trump getting set to infect the New England area all over again with a super spreader event in New Hampshire that we mentioned the other day. But before we do that, why not take advantage of the fact that today I actually have my eye on the Twitter machine and can see Bill's tweet from Portland, Maine, which will be in grave danger if the man himself shows up in New Hampshire, I guess. I don't know. It's because it's all up there in the same area, and it's really all the same thing, isn't it? And who cares if there's a mile or two separating these cities? Anyway, Daily Coast Radio is live now. Kagro X openly wonders if I'll figure out a theme for the show. Wonders if anyone else is concerned that the sitting president, and that's what he says he is, says he passed a cognitive abilities test and then admitted his doctors were surprised. Is this normal? That is a good question. I did notice that construction was awfully weird. He continues to brag. I don't know. What am I supposed to tell you at this point? The guy's bragging about a test that's basically supposed to tell you whether or not you belong in a mental hospital or not. That's like the minimum basic. If you can't pass, quote unquote, pass this test, you're too dangerous to have living on your own. You're a danger to yourself. You don't know what a camel looks like versus a lion, or you can't draw a clock showing 5 o'clock. And then they say, this is a person who can't, take care of themselves and we have to commit them to a hospital. But they found out that he could, use utensils and possibly read a clock. Although I didn't see his answers given. I just saw the, what was on the test. But he continues to brag that he aced this test as though it was an IQ exam. And it came back with some fantastic number, which even then you can only really say I aced an IQ test. But anyway, he's an idiot and he brags about everything. So not really news per se, but just a good context for the rest of the news, which who knows, maybe by the time we read it, we may find out that's not news either. Okay, I guess if I have to, do I have to click on something in order to allow them to show me this article at the Boston Globe? This might be the end of the road. I wanted to read the article, but I can't do it unless I either reject the offer or what. Here we go. Yeah, I think maybe they have a paywall. But anyway, I was struck by the headline, which was that people were worried in New Hampshire that it says some in Portsmouth fear Trump rally will bring the, quote, super spreader in chief. And I like the headline because, of course, that's kind of how I think of him. And that might, in fact, be the case. We talked about how he somehow seemed to have targeted the places that were either having the worst possible outbreak or which were finally recovering from outbreaks. It was though he was looking to make the pandemic that much worse with his quick tour. And, maybe that's true. I don't know if I can ascribe any motive to him other than trying to screw things up as badly as possible, because it sure looks like that's what he's trying to do based on what we're seeing. All right, we better hit all the highlights today. There's an awful lot of different directions we can go in. We'll do it haphazardly, more or less by what occurs to me, train of thought, and the order in which they are entered into pocket here, bringing things to mind. Something from this morning, a little concerning, but I saw some interesting feedback to it. I'm not sure what to make of this one. CNN tweeting one of their own stories, as it, most people do, which reads, a new, quote, unknown pneumonia, unquote. That is a potentially a deadlier thing. It says potentially deadlier than the novel coronavirus, the one we have now, has reportedly killed more than 1,700 people this year in the Central Asian country of Kazakhstan, according to a warning issued by Chinese officials. Stay away from the comments. They're mostly garbage. But we might take a peek in on the article just to see what we can find. Kazakhstan, though, well, I'll tell you what was going on in the comments. I did take a peek just because I was sort of scrolling down. What else might be here by way of information about this thing? Well, the answer isn't really going to be in the answers on Twitter. But, of course, most of the answers on Twitter were, oh, my God, China again. And nuke China. And what the hell's wrong with China? And it's, well, hold on a second here. It says right at the start, it's in Kazakhstan, which is not China. And it's the Chinese giving us the warning about it because they're sort of attuned to these things now. And, of course, they have, I guess they actually fund their labs that, have an eye out for new pandemic potential, whereas we've closed our eyes to that. But Kazakhstan hasn't been unscathed by the coronavirus. It's just not at the very top of the list, or as Trump would have it, the tippy top, as he likes to say, of the lists. But it is, it's not doing great, and it has kind of been creeping up in the rankings as I've looked, kept an eye beyond the sort of the top 10 charts. I guess we could go and take a peek and see how they're looking, although I'm not certain where they fall, so we might have to sort this thing alphabetically first. But, yeah, I thought I would peek in on this. The one comment that I thought might be worth something. All right, here's Kazakhstan. I think Kazakhstan came on my radar a couple of days ago because they passed the 50,000 case threshold, which is not a threshold anybody is actually paying any attention to. I'm just looking for thresholds. I'm trying to keep an eye on who's up and coming in the world of destroying their countries by failing to react properly to the pandemic. So they've got about 54,000, going on 55,000 cases there in a country of 18 million. Not horrendous, but not great, giving them a total cases per million of about 2,915, which, puts them in the middle of the pack in terms of heavy viral loads. That would probably put them about 20, 28, 29, 30, somewhere around there, I would guess. Let's see. No, lower than that. Let's see. 29, so we would say 29, 15. There we are. 49th. So not horrible, although it does place them just below the Netherlands, which has as I recall, has a score on the deaths per million that puts them in the top 10 lists nightly. So I don't know. I guess if you begin to see more deaths being reported in Kazakhstan from coronavirus, then they'd put themselves in some bad shape. So one of the thoughts that was reflected in the tweets afterwards was, well, they didn't go so far as to look at the charts as I am, but they're calling 264 deaths so far this year from coronavirus, but claiming another 1,700 deaths from a mystery pneumonia, which is, of course, kind of what they described the COVID-19 symptoms to be like in the early days, right? So somebody did just suggest, it's not something new. It is coronavirus. It's COVID-19, and Kazakhstan, for whatever reason, like we find with a lot of governments around the world, including state governments here in the United States, doesn't want to report the accurate number, or as accurately as they can, on the number of COVID-19 deaths because it'll make them look bad. So instead they say, well, we got 264 deaths from COVID-19, which is kind of like pneumonia looking in the onset, in the early going. It looks like a respiratory disease. We still don't know what kind of disease it actually is. We're finding out more horrible news each day about how many other facets it brings in. But on the other hand, 1,700 more people have died from something totally mysterious that we don't know what it is. I guess if you were to ascribe the deaths, I've been doing this math lately, if you were to ascribe those 1,700 deaths to coronavirus, plus the 264 they already have, you'd have 1,964 deaths, and with 18.781, in fact, million in population, you'd be looking at a deaths per million of 104, which would put you where? Just sort of curious where that would drop you if we forced them to, accept those 1,700. I'm just kind of curious. I mean, this doesn't really change anything for any of us, but it's a nice distraction, isn't it? Just doing some math, and so it would put them actually right in between Denmark and Monaco in terms of deaths per million. That would drop them right around, let's say, would put them in 35th place internationally. And, well, like I said, this is a sort of a parlor game that I've been playing with the statistics. It started last night as I was tweeting around the regular updates that I like to keep for my own records anyway, on how people are doing in the top 10 or so, or where the United States stands in relation to those top 10 in terms of deaths per million, in terms of cases per million, in terms of new cases reported for the day. We broke another record, of course. We're up above 62,000 new cases a day. That's making things tough for us. But I had somebody tweet back that, this was sort of an interesting take on things. If it wasn't for New York and New Jersey, if we didn't have the disasters of New York and New Jersey, we'd be way down the list. And it sort of reminds us of, remember when Trump was saying things like, well, if it wasn't for the vote in California, I would have won the popular vote because I was so overwhelmingly crushed in California. But I also lost the popular vote by somewhere between 3 and 5 million votes. If we eliminated California, he says, I would have won the popular vote. I never did the math on that, but I sort of suspected that it might be a little shaky. The margin would certainly have been different, but there were probably a lot of Trump votes in California too. There were some, and so you would have to take those out of his total too, and probably put him at a disadvantage. But, the math might have worked out. But alas, California actually a state and remains a state. And as they say, if wishes were horses, right? Anyway, so it's usually not worth indulging that sort of thing. But then I thought, this one is particularly stupid, and it's easy to imagine how the math would go in your head. And so I did. Let's see. It will be under the tweets and replies. I can scroll back a little bit and see if I can find it, because the math was laid out for the guy. But it was pretty interesting for him to say, well, if it wasn't for New York and New Jersey, we wouldn't be in the top 10 list in terms of deaths per million. Where did that go? Here we go. Let's see. So he put it that way. I had just done the deaths per million and listed the top 10, and we were at number 9 at 406 deaths per million. That's where we are now. This, by the way, now far in excess of Sweden's death rate per million in population by the time everyone had acknowledged that it was a huge disaster. Sweden now still hovering well above us at number 7 on the list, 543 deaths per million. and climbing. But anyway, this guy said, for perspective, New York and New Jersey they have 1,671 deaths per million and 1,736 deaths per million, respectively, within their population. So if New York and New Jersey were independent countries, they would, in fact, top the list, even above San Marino at 1,238, which is currently at the top of the list. And let me just make sure. We'll check their numbers. I knew I had done something like that at some point and pointed out just how bad things really were when you limit them to the smaller populations of the states. Yes, New Jersey, in fact, 1,748 currently, 1,663 deaths per million in New York. Connecticut follows with 1,220 and 1,200 in Massachusetts, and that completes the over 1,000 club. So it certainly was a disaster, but I wondered about the math of it, and then I took out the old calculator. So aside from the fact that they are in fact states and we are responsible for the deaths there, New York and New Jersey, turns out, add a combined 47,865 deaths, at least at the time of that tweet last night, without which the U.S. total of deaths from coronavirus drops from the current 135,000 or so to just about 88,000, 87,957 as of last night. It's about 88,000 deaths without New York and New Jersey. Now, across a population of 331 million people in the United States, that would drop the U.S. to 266 rather than 406, 266 deaths per million, which would not really knock us all that far down the list. As it turns out, that would put us about 18th on the list. But that's only if you decided, well, what if we got to keep the entire population of New York and New Jersey as part of the United States and nobody died there? 0 deaths in New York and New Jersey would still leave us 18th on the list. Of course, if New York and New Jersey weren't part of the United States and we could disavow them entirely, that would lower the population of the United States too, bring us down to about 302.7 million in total population, and give us about 291 deaths per million, good for 15th place, right behind Brazil. So it really wasn't all that smart of an idea to throw out there that somehow New York and New Jersey were fouling up everything for everybody. Of course, if you took them out, I don't know what would happen to GDP or your tax base, but we didn't get that far, and the guy wasn't that stupid, I guess, or that interested in having the rest of the conversation. It was just sort of interesting. And it led to another conversation a little while later that people were questioning the value, let's say, of breaking out some of these smaller territories and overseas possessions of other countries and leave, or I guess showing the totals for them separately. For those of you who may have been following along in those lists, you will see, for instance, among the new cases, both new cases reported each day and or new cases per million, I guess, anyway, but cases per million in total. You've noted that there are some strange entries on there. And people were responding, I've never heard of some of these places. For instance, of course, now we know that Qatar tops that list over and above San Marino in cases per million. And the microstates, obviously, because they're statistical anomalies, will show up at the top of these lists. And French Guiana, now having climbed to 3rd place on the list, they're really skyrocketing. But actually, they were calling out the inclusion of Mayotte, a French possession in the Indian Ocean, which resulted in some questions about why include them and why not, for instance, put their totals in with the French if they're not an independent country. This person had said Mayotte is a French overseas department in the Indian Ocean. It is an integral part of France. They actually, claim it as territory. So I don't think it should be included in the list. It would be like counting Hawaii, they say, separately from the rest of the U.S. I don't know if I agree with that assessment necessarily, but and then of course we have another complainer who says, please compare our international peers like the European Union. You do it is the answer. What I'm saying here is I'm taking Worldometer's lists and I'm just working with that. But I will say that, I've thought about that. Not that I'm going to redo the math with putting Mayotte in with France, because that doesn't really make a difference, by the way. As it turns out, the big problem is if you included them with France, nothing changes for France, really. France moves from 2,606 cases per million to 2,636 per million. As it turns out, 56th on the list instead of 55th. And that only lasts for a couple of days until Colombia passes them again and puts them down on 56. But on the other hand, by separating it out, you point out that, hey, right down here in the middle of the southern Indian Ocean, there's this tiny isolated island that nobody's paying any attention to that has one of the worst outbreaks in the world. Not that anybody's doing anything about it, but you could point out, hey, we maybe want to send some relief to this island that nobody, including France, is paying any attention to. And perhaps we should do something about it. To me, well, for one thing, I don't want to reprocess all the data. I'm just going to go with what Worldometers has. But to me, it's worth pointing out micro hotspots. Like maybe the world could give them a hand and do something about what's going on. San Marino, we can't help them too much, and they don't require the same kind of emergency intervention as Mayotte might, because they're, of course, right in the middle of Italy. And Italy is it's getting what it's going to get in terms of international relief, and some of that's going to go to San Marino too. The hotspot we're not watching for whatever reason is the Arabian Peninsula, and maybe we're not watching it because they have $1 bazillion and they're extraordinarily wealthy countries and they can take care of their own and bring in the help that they need. They're not doing it because it's the migrant worker population that's sick there. We should probably call that out and ask that they take care of the people that they have on their hands. If they're going to exploit them for labor, hey, just as an economic incentive, you're going to want to keep those people healthy so that you can supposedly host the World Cup at some point in the future. All right. Well, that's not really what we meant to spend time on. I just thought that was kind of interesting. And because there's a global pandemic, I thought I would remind you of what's going on and what might be happening in Kazakhstan. We could get back to that, of course. Just give you a taste of what they're saying there. Authorities there have denied a report published by Chinese officials that the country is experiencing an outbreak of unknown pneumonia, potentially deadlier than the novel coronavirus. On Thursday, the Chinese embassy in Kazakhstan, where else are you going to get this news, issued a warning to citizens living in the Central Asian country that the pneumonia had killed more than 1,700 people. Kazakhstani Health Department and other agencies are conducting comparative research and have not defined the nature of the pneumonia virus, the statement said. New cases of the unidentified pneumonia have been increasing significantly since mid-June across the country, said the embassy, adding that in some places authorities are reporting hundreds of new cases a day. So we hope that's not really true, although if it's coronavirus, then does it matter what we hope is killing people in Kazakhstan? I don't think so. But at least if it was COVID-19, we could say, well, I think we probably should have expected that at some point. If it really is a new pneumonia, again, well, there I don't know how much danger it poses. Hopefully it won't spread all that rapidly. And I think probably we stand a better chance of containing a strange new emerging disease in Kazakhstan than we would in an industrial center in China. But globalized trade as it is here in the modern era, you never know. Although I can't recall the last thing I picked up off the shelf at Walmart that said made in Kazakhstan. So we'll see. Just thought I'd alert you to it. It's a Friday, and who knows, by Monday we could all be worried about the Kazakhstan outbreak, and then we'll look like we are totally on the ball and ahead of the game. All right. Meanwhile, here at home, good news for my mom, who's sitting there in South Carolina. I say that tongue in cheek, but I'm going to have to keep my tongue here because it says, and the rest of me as well, worse than New York. The Daily Beast's headline reads, How Coronavirus Exploded in South Carolina. Oh no. South Carolina now getting the headline. South Carolina is besieged by the coronavirus, reporting more cases per capita than most countries. But we already know what that might mean. We've completely lost control of the situation, one doctor told The Beast. I love how they refer to themselves that way. Pilar Melendez and David Axe wrote this piece that is guaranteed to scare the crap out of all the folks in the area at one hospital in Charleston, South Carolina, which, by the way, had not been the center of South Carolina's outbreak until recently. It had been more upstate toward Columbia, as I understood things. But now in Charleston, emergency room nurses are recycling used N95 masks as doctors and other departments pitch in to staff the COVID-19 unit. At another, shortages have forced healthcare staffers to work unprecedented overtime. All told, more than 75% of hospital beds are already occupied across the Palmetto State, and the tidal wave of new coronavirus cases is only growing. Simply put, South Carolina hospitals are under siege. And you know, where you want to be, I guess, is over siege, I suppose, if you got to be anywhere around a siege. We're going to be worse than New York, one Charleston ER nurse told the Daily Beast. And I bring this up, not necessarily to scare the crap out of people in Charleston, South Carolina, but to point out that we could easily have spent the earlier part of the show reading you stories in which Houston claims it's going to be worse than New York, or Miami-Dade claims it will be worse than New York, or Oklahoma says it's going to end up being worse, or Arizona is going to be worse than New York. And the problem is we have half a dozen places, all now poised to be worse than New York. Well, we'll be right back. Hi, it's me, David Waldman, your host for Kagro in the Morning, and I've learned that I either need to update these announcements more often or stop saying that the announcements are brand new. What's not new is that this message, too, is a call for your support in keeping the Kagro in the Morning show on the air. My thanks go out to all of you who do support the show through your donations. The stats say that Kagro in the Morning fans download our program about 2,000 times each weekday. But our donors make up only about 8% of our daily listeners. Patreon.com, Patreon.com, makes it simple to make easy, secure, recurring monthly contributions to support our show. Patreon.com/KagroX gets you straight to our donation page. If we're helping keep you sane during the Trump era, consider what that's worth. $1 a day? 50 cents? One thin dime? We do about 20 shows a month, so pick a number, do the math, and head to patreon.com/KagroX to let us know. Thanks again, everyone, for all your support. All right, welcome back now to the Kagro in the Morning Show here on Netroots Radio. All right, try and get back on track for the Friday. Yeah, Mighty OCD sending around the clip from, A Beautiful Mind, with the John Nash character here staring up at the board and spinning around with all the numbers in my head, with someone saying someone's going to have to send somebody in after me pretty soon, get me out of the numbers game. Back on track, sort of, but still scattered. Reading the coronavirus news, this seems to continue to obsess me. By the way, did you happen to see there was, I don't know, some random dude tweeting some garbage yesterday about, what was it? He was going on about how, and he's like a Brookings Institution guy, too. I don't know. I've never seen anything quite like it, but he was saying, it's been the most amazing, I guess, like sort of cultural phenomenon in the last couple of days. Americans all over the country have totally put coronavirus and all the concerns associated with it behind them. And it's been the most amazing cultural shift. Just stop paying attention to coronavirus entirely. And it wasn't one of those things like complaining about, I went to a store and nobody was wearing any masks, so everybody's pretending it like never happened. It was something different. Here we are. Shadi Hamid, who's a blue check mark kind of a person. It was just sort of weird. Yeah, so right around a little after the show yesterday, just saying here's, I don't know who he thinks he's talking to. I'm looking back at different iterations of my book proposal. Okay, so what, right? COVID started, It seemed like everything. And I hurriedly tried to make my proposal COVID relevant. Sure, you want to sell your book proposal, right? Reading it today, it comes across as quaint, now that few seem to care much about COVID. Huh? And then the tweet, I actually kind of had to react to, was the next one. The way we stopped caring about COVID is the most striking shift in mass perception I've ever witnessed in my 36 years of being alive. And I would suggest maybe a few more would be wise. I mean, we all wish you several more, but maybe a few more before you decide about what's the most striking shift in mass perception about anything. I mean, it goes on for a little while that we entered the post-COVID era, despite there still being COVID, says something about human beings' remarkable ability to adapt. We know that this is a psychological coping mechanism, but to actually see it play out so quickly in the span of 2 months is mind-boggling. Across the political spectrum, everyone, almost as if something just clicked, decided to move on. If I recall, it happened in the span of 3 days. That was the most remarkable part of the claim. In 3 days, there was this huge turnaround. I remember one day I was having dinner with my parents and COVID was all we talked about. Then later that week, it just stopped. And it's like, well, for one thing, I mean, clearly that would be the case for you and maybe not for everybody else. I was just like, you're going to have to write that book, guy, because I did not see what you were talking about. But then again, you were having dinner with your parents earlier in the week, which drops you probably pretty squarely into the category of people who just stopped caring about coronavirus. So it happened to you. What was interesting is you were saying you were having a conversation with your parents at dinner about how outrageous the whole coronavirus thing was, and then suddenly it went away, except during the time that you counted as being concerned about coronavirus, you were clearly unconcerned about coronavirus because you were having dinner with your parents. Unless there are 36-year-old senior fellows, believe it or not, senior fellow at the Brookings Institution, 36, senior fellow. I guess they're making everybody seniors these days. And so, I mean, unless you're living in your parents' basement, which would explain why you could have dinner with them safely during a coronavirus outbreak, or I suppose having a socially distanced outdoor picnic dinner. I don't know. It's not described here. But maybe you weren't taking coronavirus all that seriously from the beginning. I just thought that was weird. And so he says, honestly, I've never experienced anything like it in my life, though he's only 36. And I still can't really get my head around it. And maybe it was never even in the neighborhood. Your head was elsewhere. Could be entirely thinking deep thoughts, I'm sure, as a senior fellow for Brookings Institution. So now I have to think about how to purge my book proposal of COVID references, because if I keep too many of them in, readers' eyes will glaze over and they'll think I'm some crazy person. We wouldn't want that to happen. I don't know. Has anybody felt that? I've felt that people have let their guard down. I felt that people got COVID fatigue and gave up. But the idea that in a 3-day span there was a mass cultural shift to where we're now post-COVID, I don't think so. Quick, write that book, because I don't know. It's going to be 1 in a million. It's going to be a collector's item soon. I don't know. Anyway, I thought that was kind of strange. Elsewhere in the world, though, as it turns out, for instance, in Texas, one of the other places that's going to be one of the 5 or 6 places that turns out to be worse than New York, I also saw tweeted yesterday that we knew things were getting real, because as it turns out, they were the experts, whoever they are, in this particular subject, were predicting no high school football in Texas for the upcoming year. And that was, as our tweeter friend here, Bomani Jones, tweeted, "This is how you know it's real," showing us the Jeff Reynolds tweet. The superintendent of schools in Dallas told MSNBC high school football in the state of Texas, highly unlikely in 2020. No high school football in Texas. Prepare yourselves accordingly. I think Bomani has it quite correct there. That's how you know it's real. Elsewhere, you know it's real by the number of people who are catching the disease. From the BuzzFeed news desk here, let's see, what do we got? David Mack, is that our author? Yes. A Christian summer camp shut down after 82 kids and staff got the coronavirus. So how's it going on the school front? How are we going to deal with that? The answer is it's not going to work. Although when I searched around, by the way, on Twitter for the news about this camp, it turns out there's conflicting reports about whether it's really closed or not. It's a network of camps, so that might be adding to the confusion. Kanakuk, is that how they pronounce it? Kanakuk. Kanakuk? Can I cook? I don't know how they, but if any of you are familiar with it, tweet me and I'll read the message 15 minutes later. The Kanakuk camp in Lampe, again, Lampe, Lampe, I don't know, Missouri, had promised kids ages 13 to 18, which is outside the sweet spot for where people are still claiming, hey, kids don't get it. But whatever, they're a camp and they want money. They had promised kids ages 13 to 18 fun activities and Bible studies, both. But campers were sent home last week due to a coronavirus outbreak. And among the tweets about the camp network, I noticed that people were saying, yeah, some of these kids who were sent home are distributed across 10 states in their home states. And so we brought them into Missouri, gave them coronavirus, and then distributed them back across the country to create more places that will eventually be worse than New York. Anyway, among the various Twitter comments, I also saw stories mentioned in which, and again, if it's a network of camps, it's more difficult to make sense of. You just have to be familiar with the camp, I guess, to know exactly what's going on. But it sounds like maybe not, the camp didn't shut down entirely, or that there was an earlier outbreak and they shut down for a week or two and then reopened and it had a bigger outbreak and then shut down again, but that they're still planning on having a second August session. So they just can't stop infecting people. They love it there in Missouri. Let's see. A summer camp run by a Christian group in Missouri is shut down after more than 80 children and staffers tested positive for the coronavirus, health officials said. Organizers of the Kanakuk K2 camp in Lampe, in the state's southwest near the Arkansas border, one of the stealth hotspots that gets revealed in my occasional dives into the new cases, daily new case reports per million in population. Who's got the most new cases per capita consistently sticks Arkansas back up on a list that they miss otherwise because their population is too small. Well, anyway, they made the decision to shut down last week due to a number of suspected cases, according to the Stone County Health Department. On July 2nd, health officials said at least 41 campers and staff had tested positive. By Monday, that number had doubled to 82. So Monday was the 6th, right? So the number doubled between the 2nd and the 6th. That's too fast. You can't have that. Health officials said the children were returning to their homes in 10 different states, as well as multiple Missouri counties. The decision to close has resulted in all campers, counselors, and staff to return to their homes, they said on Facebook. SCHD, Stone County Health Department, will be working closely with Kanakuk camps, which they spell with a K, which is a little iffy these days. But okay. To identify exposed individuals and quarantine those individuals as necessary. Per the camp's website, the shuttered camp had welcomed teens ages 13 to 18 for up to 4 weeks of, quote, over-the-top fun and activities, deep friendships, biblical discipleship, and focused sports training and coronavirus infection. Left that part off, but according to NBC News, which earlier reported the cluster, parents were notified of the camp closure via email last week. As your camper, with a K, returns home, Kanakuk Health Services Director Rebecca, with 2 C's, no K's there, Duncan, also with a C, reportedly wrote to parents, we recommend that you consider a 14-day self-quarantine for your child and monitor for symptoms of COVID-19, which is a great idea. Once you've got it. Getting it is a terrible idea. Staff at Kanakuk, which operates at least 7 different camps, there we go, did not respond to requests for comment from BuzzFeed News. The camp has also made no mention of the outbreak on their social media channels, instead continuing to share images of happy campers enjoying outdoor activities. It's unclear whether the numbers are distributed among all 7 camps or whether one particular camp is responsible for all or most. I don't know. unclear at this point, but just sort of, I thought I'd throw it in there as an indicator of how are we going to do when it comes to returning to school. By the way, on their website, Kanakuk had sought to comfort parents looking to send their kids off for some summer fun after months of being cooped up due to the pandemic. As part of more than 30 measures being taken to prevent an outbreak, staff were said to have installed medical-grade air filtration systems and hand sanitizers in each cabin while requiring the campers to sleep head to foot. Not going to help a great deal, I'm sure. And I don't think there are any. I don't know. I mean, the idea that they installed there are air filtration systems that are available that might be of some help in all things, but the idea of installing like hospital grade air filtration systems in camp bunks seems like it wasn't really going to work. And I guess it didn't. Hand sanitizer is a good idea, though. They should absolutely have that in there. That's good news. All right, let's see. Oh, here's some comments coming in via our Twitter feed. Let's see. Pete B2. Peter says, I listened to the podcast for yesterday's show and was particularly interested in the discussion about schools operating and what they do when there's a confirmed case at school. CDC requirements for who needs quarantine seem to be more limited than what you and Greg were talking about. Yeah, well, I bet they are. They are now anyway. Although there's now everybody's fighting about whether or not they're going to revise them or whether they've been revised or whether they're going to defy the president or secretly do what he wants but say they're defying the president. That's going to be interesting. But right as they stand now, yeah, and they're inadequate to the task. I'm sure about it. But let's see. Pete goes on to say, if it's just those within 6 feet for 15 plus minutes, the dragnet won't be very big. And that's true, but then it also won't contain the disease. With airborne transmission likely being a way COVID-19 is spread, I'm doubtful these rules will prevent all the spread, but at least on the issue of what the CDC guidance requires, it won't necessarily empty schools because lots of people who were, quote, in contact with a confirmed COVID-19 positive person. It may be. It may be the case that per current CDC guidelines, and I guess the problem with reporting a story like this is you never have any idea really what's happening internally in CDC, but it's now become more important than ever because at one level, the CDC could be recommending, yeah, absolutely. If you're inside a small-ish classroom, even if you're spaced 6 feet apart, even if you're wearing masks, given how the thing spreads, if there is spread inside of a classroom, well then, all the people who are in there for the 45 minutes or whatever it takes to teach the class have been exposed and ought to self-quarantine. But then, of course, the president complains, and I'm sure more people than just the president complain. I'm sure parents would complain. Well, if the kid was 20 feet away and they were both wearing masks, does that really require his quarantine? And, I think what I've learned about, like, for instance, the contact tracing, the guidelines, I guess, provided by CDC for contact tracing, those people would all fall outside of the contact tracing target list, right? They'd be asking you, if you're sick, who have you spent more than 15 minutes with in closer proximity than 6 feet in the last X number of days? That's the part of the protocol I don't know. I think they're going with like 2 days before any symptoms set in, and then going forward from there. But I may have that number wrong. And I guess if you answer the question strictly, no, not. I guess if they follow the rules, nobody inside that classroom will fall within those guidelines. I didn't spend 15 minutes plus closer than 6 feet with anybody. Of course, over in Fairfax County schools, they'll say, yeah, just about everybody, because they're going with the 3 feet distancing instead, which, by the way, I don't think we thoroughly treated yesterday, but apparently, having had it clarified after the show, my wife continuing to talk to me about it, as she did during the show yesterday, which was fine, keep us up to date and remind us what we need to be telling people before we take breaks. But I guess the 3-foot distancing that's accepted by the World Health Organization, and I forget who else was, but I guess, the American Academy of Pediatrics. Basically based on the idea that, look, it may outweigh things. We may have more interest in getting kids back in school than we do in enforcing 6-foot distancing, given that it's probably at least somewhat effective to have 3-foot distancing. 6-foot distancing isn't 100% effective anyway. What about 3-foot? How would you do? And I guess if the statistics showed you that, well, you'd prevent about 75% of the transmissions by adhering to a 3-foot distancing, or, even if it's 65 or really 50% as effective as 6 feet. I don't know I doubt it's that neat, the numbers. Probably you do prevent about 75%. You want to prevent many more, but if it's 75% effective to do 3 feet, maybe the risk is outweighed by the benefits of getting the kids back into school, both the benefits to the kids themselves and to the economy, right? So that's a possibility. So we have, the problem is there's no real science on it, and nobody has had a chance to actually study it in place, which could, in fact, bring us to our one of several choices for next stories. Greg brought us to Science Magazine yesterday for something else. But I saw in the sidebars there a very interesting other article that I clicked on and said, you know what, we can share this. We can blame Sweden for so much more than we heap on them now. Everyone, I think, is pretty much universally acknowledging the failure of the Swedish experiment. But one part of the experiment was that they kept school open for their younger grades, thinking it would help, I guess, probably economically. There would still be childcare, and then kids over, 14, 15 years of age who weren't going to school could probably take care of themselves during the day anyway while parents were out at work. Plus, of course, that weird stat that something like that the Swedes work at home in greater numbers than any other population across Europe. So, it might have made some sense to try and gamble with this thing. Here's what they didn't do. How Sweden wasted a rare opportunity to study coronavirus in schools. Well, again, just like with other headlines elsewhere, this is really a headline about the fact that Sweden wasted a rare opportunity. How they did it was they didn't study coronavirus in schools. End of story. But that is, in this case, the better of the stories. This from back on May 22nd, we discovered how badly Sweden screwed up on this. Gretchen Vogel writes this piece for Science. Let's dive into it. There's nearly universal agreement that widespread, long-lasting school closures harm children. We are finding that it's the case that the experts are saying this now, even here in the United States. Not only do children fall behind in learning, but isolation harms their mental health and leaves some vulnerable to abuse and neglect. But during this pandemic, does that harm outweigh the risk to children, to school staff, families, and the community at large of keeping schools open and giving the coronavirus more chance to spread? The one country that could have definitively answered that question has apparently failed to collect any data. And there's some good reasons for it, but also some bad ones. Bucking a global trend, Sweden has kept daycare centers and schools through the 9th grade open since COVID-19 emerged, without any major adjustments to class size, lunch policies, or recess rules, which is how Trump would like it to be going forward in the United States. So we could have studied this thing, like, okay, you're going to do this, keep some track of how you're doing. We tracked everything else, and it turns out you sucked at that, and just like to know if you also suck at this. But I'm sure they weren't anxious to own up to it. Or maybe they even knew it wasn't going to be very good. But anyway, they went ahead with it. That made the country a perfect natural experiment about schools' role in viral spread that many others could have learned from as they reopen schools or ponder when to do so. Yet, Swedish officials have not tracked infections among school children, even when large outbreaks led to the closure of individual schools or staff members died of the disease. which tells you a good portion of what you need to know to make some sort of surmise. What they're basically telling you is we kept schools open for the most part, but on occasion we had significant clusters of the disease inside schools, whether among the kids or the teachers or the staff. I don't know. They probably have some idea, but not as much as they should. And they had to close individual schools, even as they said they kept school open. Not all of them. And essentially, Sweden not only showed for us the idea of, well, keep most things open, and either, whether they acknowledged that they were headed for or trying for herd immunity or not, that whole experiment didn't work. And as it turns out, neither does the school one, at least without some modifications to their program, which is, most schools in the United States are saying that's what they want to do. Then there's the question of whether the president will do anything or can do anything to prevent them from doing so. It's really frustrating that we haven't been able to answer some relatively basic questions on transmission and the role of different interventions, says Karina King, an infectious disease epidemiologist at the Karolinska Institute, or KI. That's Sweden's flagship medical research center. King says she and several colleagues have developed a protocol to study school outbreaks, but the lack of funding, time, and previous experience of conducting this sort of research in Sweden has hampered our progress. We are trying to mobilize, but realistically, with the school year ending in a few weeks, it seems unlikely, remember this was back in May, it seems unlikely we will be able to get what we want up and running, says King, who adds that her queries to public health authorities about other efforts have come up empty. There is some data collection happening in children, but it's not focused around schools, or, as far as I know, will not answer questions around transmission. Because children rarely suffer severe symptoms of COVID-19, and we still have some questions about that, pediatricians in several countries have called for schools to reopen. But a key question remains. Because people with mild symptoms can be extremely infectious and frequently spark large clusters of infections, could schools also be a source of COVID-19 outbreaks, possibly driven by children who feel fine, but can pass the virus to each other, their teachers, and their families? That's the million-dollar question. Or put your own value on the question. It's a valuable one, regardless. Health officials and researchers around the world are scrambling to answer that question. Key to that effort is tracing whether infected children spread the virus to people they've been in contact with. I'm concerned that there may be a rush to judgment that asymptomatic school children aren't spreading COVID-19 to adults, says Anita Cicero, an expert in pandemic response policy at Johns Hopkins University's Bloomberg School of Public Health. Again, too many titles in there. Is that our own Mike Bloomberg paying for that? In Sweden, they have had a rare opportunity to understand school transmission chains better, but you can't find what you don't look for. The U.S. and other countries with closed schools would certainly benefit from that research. Emma Franz, a clinical epidemiologist at KI, who also writes a regular newspaper column on science and health, says Sweden's overall goal during the pandemic has not been to eliminate transmission completely, but to prevent the health system from becoming overburdened and to protect the elderly. It has succeeded in the former, but not the latter. Sweden has suffered very high mortality among nursing home residents. Regarding schools, Franz says, most people in Sweden are quite happy with them being open. She acknowledges the lack of data is a missed opportunity. With Sweden's centralized health system and extensive records, it would have been possible to track cases fairly easily had there been more testing. But KI pediatrician and clinical epidemiologist Jonas Ludvigsson, who has published 2 review articles about COVID-19 in children, thinks tracing infected people's contacts is of little use at this point in the epidemic. So it may be too late for them to even try now. The virus is so widespread in society that responsible people do not think it is a good idea to trace individuals. We only test symptomatic individuals, and I agree with that. He wrote in response to Science, asking whether researchers were tracking school outbreaks. Ludvigsson added that Swedish privacy laws allow healthcare personnel and school officials to notify parents and school staff about an infection only, quote, if a person's life is at risk. Well, with kids, is it? Because severe complications from the new coronavirus are so rare in children, that does not apply to cases of COVID-19, he says. Consider, by way of explanation, he says, consider if your own child had COVID-19. None of the kids will want to play with a child who has COVID-19, even if most kids have no symptoms or only some fever and cough. In a review paper published in May 19th in Acta Pediatrica, Ludvigsen concluded that children are, quote, unlikely to be the main drivers of COVID-19 spread. He cited case studies from France and Australia, but wrote that so far there have been no reports of COVID-19 outbreaks in Swedish schools, citing personal communication from Anders Tegnell, Sweden's state epidemiologist, on May 12th. This supports the argument that asymptomatic children attending schools are unlikely to spread the disease, Ludvigsen wrote. However, a scan of Swedish newspapers makes clear that school outbreaks have occurred. So, bad data, I guess, behind that conclusion. In the town of, Skellefteå, I have no idea how you would pronounce it, don't worry about it. In that town, a teacher died, and 18 of 76 staff tested positive at a school with about 500 students in preschool through 9th grade. The school closed for 2 weeks. That was what we thought was going to be sufficient in the beginning of our outbreak, right? The school closed for 2 weeks because so many staff were sick. They were forced closed, just like Greg said they would be. The virus would dictate things, right? But the students were not tested for the virus. In Uppsala, staff protested when school officials, citing patient privacy rules, declined to notify families or staff that a teacher had tested positive. No contact tracing was done at the school. At least 2 staff members at other schools have died, but those schools remained open and no one attempted to trace the spread of the disease. Wow. Okay. Missed opportunity for sure. We'll be right back. All right. Welcome back now to the Kagro in the Morning Show here on Netroots Radio. Shall we continue on? There's only a little bit left. We can get the full picture here from science on what's going on in Sweden. It was something of a missed opportunity. I think we can all agree with that one. Let's see. We left off when we were saying that the Swedish privacy rules kind of precluded letting people know that, hey, there are sick people in your school. And, I don't think we have that problem here. But, we certainly have privacy rules to deal with, but I think we can work with them for contact tracing purposes. So let's see. What was most interesting, really, was that the country's chief epidemiologist said, there's been, we've had the schools open and there's been no reports of any COVID outbreaks. And I guess, as it turns out, it's because privacy prevented you from telling people that the outbreaks were COVID-19, and then you were stuck. But as it turns out, taking a look through Swedish newspapers, no small feat. I think you have to be able to read Swedish in order to do it. But I gather that Anders Tegnell really could have done that. Or he could have Swedish Googled to find that out. And, no, schools are closing there. Anyway, let's see. We'll continue on here. At least 2 staff members, we had learned, right, had died in Uppsala. But those schools remained open. No one attempted to trace the spread of the disease there. When asked about these cases, Ludvigsen said he was unaware of them. He did not respond to a query about whether he would amend the review article to include them. I think he should. An indirect clue about schools' role in spread might come from antibody studies. On May 19th, the Swedish Public Health Agency announced preliminary results from antibody surveys of 1,100 people from 9 regions. And I've heard something about their antibody surveys right about the time where they started to deny that they were ever interested in herd immunity. Studies became available that said, about maybe 7% of people in Stockholm area have got antibodies. I don't think the herd immunity is coming. But I've seen different numbers, not from Sweden, but from here in the United States. Maybe we can dig up that article. Let's see. Note to self about the antibodies studies it was in New York, good old New York City, and I may have parked that in Pocket, but if not, I'll dig it up for you. So here's the results from Sweden. They reported that antibody prevalence in children and teenagers was 4.7%, compared with 6.7% in adults aged 20 to 64 and 2.7% in 65 to 70-year-olds. And of course, 65 to 70-year-olds would be, even in Sweden, sheltering more aggressively and trying harder to avoid the virus than everyone else. But interesting. So children and teenagers, though, lower than adults ages 20 to 64. I guess the adults are out and about and mixing in society. Kids go where their parents bring them. Anyway, the relatively high rate in children, is that really relatively high rate? 4.7% antibody prevalence? Suggests that there may have been significant spread in schools. Not enough, though, to get to herd immunity anyway. The agency did not provide more specific data to distinguish between younger children and those in high school and universities, which have switched to remote teaching. You're going to have to differentiate between those populations to get anything of use out of that. The missed opportunity in Sweden is a wake-up call, King says. We need ready-to-implement protocols for basic epidemiology during these situations. Studies now underway in other European countries may soon provide more clues, and Cicero and colleagues issued a call last week to fill in the blanks in the understanding of U.S. schools' role in the pandemic. That'd be nice to know, don't you think? We need a national mandate to prioritize and quickly fund research to answer these scientific questions, they wrote. Well, tough crap. That ain't happening. As schools reopen, computer models are not sufficient to determine the actual risk to school-aged children and the teachers and caregivers in their lives. And we know that, and you're not going to get an answer until we do real-life trials with all your kids. That's where we stand in relation to our Republican-run government. So we'll find out when people die, and then if they do, they do. And that's the upshot of it. Oh, good. Here, parked right next to it, is the word from the New York Times, which reports, and this is a much higher number, 68% have antibodies, where? In this clinic. We'll find out what clinic, but it's very, very good tease here. Can neighborhood beat a next wave? Data from those tested at a storefront medical office in Queens is leading to a deeper understanding of the outbreak's scope in New York, at the very least. Joseph Goldstein wrote this piece for New York Times. Let's get a quick taste of what this is about. At a clinic in Corona, a working-class neighborhood in Queens, right, where Rosie reigns as queen. You know who I'm talking about. More than 68% of people tested positive for antibodies to the new coronavirus. And you would imagine that there's a lot of it circulating at a medical clinic in Queens. At another clinic in Jackson Heights, also in Queens, that number was 56%. So, comparable, I guess, right? But at a clinic in Cobble Hill, a mostly white and wealthy neighborhood in Brooklyn where people could hide, right? Only 13% of people tested positive for antibodies. As it has swept through New York, the coronavirus has exposed stark inequalities in nearly every aspect of life, from who has been most affected to how the healthcare system cared for those patients. Many in lower-income neighborhoods where Black and Latino residents make up a large part of the population were hard hit, while wealthy white neighborhoods suffered much less. They didn't use white. We know who's in the wealthy neighborhoods. Not everybody, but a pretty good percentage of them. But now, as the city braces for a possible second wave of the virus, controversial, some of those vulnerabilities may flip, with the affluent neighborhoods becoming most at risk of surge. According to antibody test results from CityMD that were shared with the New York Times, some neighborhoods were so exposed to the virus during the peak of the epidemic in March and April that they might have some protection during a second wave, if those antibodies last. That's one of the other big questions. Some communities might have herd immunity, said Dr. Daniel Frogel, a senior vice president for operations at CityMD, which plays a key role in the city's testing program. The CityMD statistics, which Dr. Frogel provided during an interview and which reflect tests done between late April and late June, appeared to present the starkest picture yet of how infection rates have diverged across neighborhoods in the city. And I guess they were chiefly after that, more so than are we going to have herd immunity. As of June 26, CityMD had administered about 314,000 antibody tests in New York City. Citywide, 26% of the tests came back positive. But Dr. Frogel said the testing results in Jackson Heights and Corona seemed to jump off the map. While stopping short of predicting that those neighborhoods would be protected against the major new outbreak of the virus, a phenomenon known as herd immunity, several epidemiologists said that the different levels of antibody prevalence across the city are likely to play a role in what happens next, assuming that antibodies do, in fact, offer significant protection against future infection. Even that's not really sure. In the future, the infection rate should be really lower in minority communities, said Kitaw Demisi. I don't know how I'm mangling that name, but okay. An epidemiologist at the dean of the School of Public Health at SUNY Downstate Medical Center in Brooklyn. Dr. Ted Long, executive director of the city's contact tracing program, said that while much remained unknown about the strength and duration of the protection that antibodies offer, he was hopeful that hard-hit communities like Corona would have some degree of protection because of their high rate of positive tests. We hope that will confer greater herd immunity, he said. Neighborhoods that had relatively low infection rates and where few residents have antibodies are especially vulnerable going forward. There could be some degree of catch-up among the neighborhoods, said Professor Dennis Nash, an epidemiology professor at the CUNY School of Public Health. But he added that even if infection rates were to climb in wealthier neighborhoods, there are advantages to being in the neighborhoods that are hit later. For one, doctors have become somewhat more adept at treating severe cases. Some epidemiologists and virologists cautioned that not enough data exists to conclude that any areas have herd immunity. For starters, the fact that 68.4% of tests taken at an urgent care center in Corona came back positive does not mean that 68.4% of residents had been infected. For sure, the persons who are seeking antibody testing probably have a higher likelihood of being positive than the general population, Professor Nash said. If you went out in Corona and tested a representative sample, it wouldn't be 68%. So far, the federal government has released relatively little data from antibody testing, making the CityMD data all the more striking. CDC, for instance, has published limited data that suggested that 6.93% of the residents of New York City and part of Long Island had antibodies. But that survey was based on samples collected mainly in March, before many infected New Yorkers might have developed antibodies. New York State conducted a more comprehensive survey on antibody rates, which involved testing some 28,419 people across the state. The survey suggested that roughly 21.6% of New York City residents had antibodies, but it also revealed a much higher rate in some neighborhoods. While the state has released little data from Queens, its numbers showed that in Flatbush, in Brooklyn, for example, about 45% of those tested had antibodies. The CityMD data provides similar conclusions. At a location in Bushwick, a Brooklyn neighborhood, which has a large Hispanic population and where the median household income is below the citywide average, some 35% of antibody tests were positive, according to Dr. Frogel. Dr. Frogel said that across the Bronx, which has had the city's highest death rate from COVID-19, about 37% of antibody tests were turning up positive. The CityMD in Corona on Junction Boulevard serves a predominantly Hispanic neighborhood whose residents include many construction workers and restaurant employees. Many had to work through the pandemic, raising their risk of infection. Angela Rasmussen, a virologist at Columbia University, called the high positive rates in Corona a stunning finding. Epidemiologists said the rate showed the limits of New York's strategy in curtailing the virus. While public health measures may have slowed the spread in some neighborhoods, they did far less for others. There are reasons parts of Queens were hit so hard. Homes in Elmhurst and parts of Corona are especially crowded, the highest rate of household crowding in the city, according to Census Bureau data from 2014. Given that transmission among family members is a leading driver for the disease's spread, it is unsurprising that crowded households have been associated with higher risk of infection. For residents of Corona, the main sources of employment are jobs in hospitality, including restaurants, as well as construction and manufacturing, according to a 2019 report by the Citizens Committee for Children of New York. Many construction workers and restaurant employees showed up to work throughout the pandemic, elevating their risk of infection. Our plan did not really accommodate essential workers as it did people privileged enough, for lack of a better word, to socially distance themselves, Professor Nash said. He said that one lesson of the past few months was that the city needed to better protect essential workers, everyone from grocery store employees to pharmacy cashiers, and make sure they had sufficient protective equipment, which they won't because Jared Kushner is hoarding it all. Epidemiologists have estimated at least 60% of the population, and perhaps as much as 80%, would need immunity before herd immunity is reached, and the virus can no longer spread in that community. But scientists say it would be a mistake to base public health decisions off antibody rates across a population. And here's some scientific terminology. Ready? Just looking at seroprevalence, or I've heard seropositivity as well. Seroprevalence alone can't really be used to make actionable public health decisions, Dr. Rasmussen, the virologist at Columbia, said. One reason is that the accuracy of the antibody test is not fully known, nor is the extent of immunity conferred by antibodies or how long that immunity lasts. Dr. Rasmussen noted that the magical number of 60% for herd immunity assumes that everyone infected has complete protection from a second infection. But what about people with partial protection? She asked. They may not get sick, but they can get infected and pass it along. It is premature to discuss herd immunity since we are still learning what the presence of COVID-19 antibodies means to an individual and whether or for how long that conveys immunity. And we don't know how the level of immunity in a single community translates to herd immunity, said Jonah Bruno, a spokesman for the State Department of Health. He said he was unsurprised by the high rate in corona, and senior officials with the city's contact tracing program and public hospital system agree. We know this area was disproportionately affected, said Dr. Andrew Wallach, senior official at the city's public hospital system. So this just confirms what we've seen clinically. So we're still left with a bunch of questions and not much in the way of answers, but at least the start of something to keep an eye on. The problem, of course, is that some of these neighborhoods in New York City are pretty compact, and mobility into and out of some of these neighborhoods is pretty high. And especially if you've got high seroprevalence in one small neighborhood and low seroprevalence in a neighboring neighborhood, although the lack of physical barriers is sometimes misleading in terms of how little interaction there can sometimes be between neighborhoods. Eventually, things will leak across those non-existent borders anyway. And finding out that certain neighborhoods of Queens or the Bronx have less prevalence of the disease in any second wave isn't really going to do much for you, especially if it turns out that antibodies don't even really help you. There's still a lot of the city and a lot of the country still very much vulnerable to the virus. And if there's some relief for healthcare workers at clinics in some of these neighborhoods, that's not going to do too much when the problems are out of control elsewhere. Let's see. Speaking of which, I think down in Texas, the latest from the government there is that the brilliant governor has reacted to this outrageous, out of control outbreak that might cancel high school football by saying, okay, we're going to ratchet back only 50% capacity on indoor dining from now on, which of course is going to be insufficient to containing their outbreak. But maybe they'll get herd immunity, or, maybe not. Maybe there's no such thing. But it is very interesting. And I think that this story will likely fuel people on Twitter to say, see, they're headed towards herd immunity already in certain neighborhoods of New York, which is just proof that we should just let the virus wash over everybody, which of course sets aside the whole, the rest of their argument, which is usually things like, sure, Florida has a raging epidemic and their numbers are spiking like crazy, but where are the deaths? Now the deaths are, of course, beginning to catch up, and, given enough time, we'll probably see things equalize and they'll have a rate of death, hopefully somewhat less than they saw Where? In New York, which they're now holding up as an example. This is the way we should let the virus affect us. We should turn every place into New York. And remember that herd immunity, that's the good part of the deal. Immunity. Everybody likes immunity. And if you're lucky enough to live to see it, then congratulations. You get to enjoy the benefits of herd immunity. But how do you get to herd immunity? You let everybody who can be killed by the thing be killed by the thing, and everybody who can be damaged by the thing be damaged by the thing. And then we're in luck. The good news starts after all the death and damage is done. That's the part that gets left out of the brilliant argument for herd immunity. Let's kill everybody who could possibly die from this. And, if what we learned yesterday turns out to be true, everybody gets brain damage as well. But if you survive and can work through the brain damage, the good news is you won't get it again. Maybe. COVID-20? Yeah, can't help you with that one. But COVID-19, you might be safe, or you might not. But, let all the death and destruction, I think, speak for itself. All right, let's see. Other things that we happen to have put aside here for discussion include stories that don't have anything to do with COVID-19. But I do think we have a few more that we're going to want to hit on that front. Did we? Okay, we found the New York City Antibody study. There was also, where did we read this? I read yesterday that there was, Arizona. Right. I'm going to have to dig up the Arizona story. Arizona, I guess, was experimenting with the protocols, I guess, that it hopes to use in reopening schools. It sounds like what they were doing was using the summer school session to experiment with ideas like, well, what would happen, or what kind of classroom density can we get away with, and can we, for instance, if we have to teach summer school, I think what happened here was I might have to search again through my tweets and retweets. I'm pretty sure I probably sent this on, and we'll have to find the article. But it sounded like what they were doing was, as long as we're going to have to teach summer school, let's do it this way. Let's have 3 teachers. Let's have the teachers come in and teach remote summer school classes, but teach it from the school building. And we will sanitize the building, and we'll socially distance the teachers, and we'll have them wear masks while they're teaching, and we'll have them stream out their classes using their own computers, and we'll have them sanitize the computer surfaces and all of this stuff, and see if we put 3 teachers in a room and put them each in a corner and socially distance, is that sufficient to keep them from spreading the disease between themselves while they're in the building? And the answer in this particular experiment, or at least in this one particular instance on which they're reporting, was no. Somebody brought the disease in with them from somewhere, and all 3 teachers who were in this article, anyway, I don't know how many teachers were in the building, I don't know how many classrooms they had filled, were these the only 3 teachers doing this, but they all got the disease, and one of them died. And I guess that leaves the officials in the school system there in Arizona scratching their heads. If you can't have 3 people, 3 adults anyway, per classroom, sitting in various corners of the classroom as distant as they could possibly be, with masks, survive the summer session, then it doesn't look good for bringing kids back to school and keeping the teachers healthy while we do it. Now I can't find the article, so I'll have to search a little more broadly. But that deserves some investigation as well. If we're running experiments with how does it go with masked teachers sitting across the room from each other, and the answer is nope, they die, then especially if we're bringing kids back to school to avoid the psychological damage that comes from keeping them apart for so long, should we start thinking about the psychological damage that comes from watching their teacher die? I think there's probably some from that. And even if the kid, even if that doesn't happen, and we certainly hope it doesn't, what's the psychological damage of, or the educational damage from having 2, 3, 4, 5, 7, I don't know how many teachers it will take to complete a semester with these kids. I had, 4 long-term substitutes in my Algebra 2 class or my history class because they kept getting sick with coronavirus, or being in the same room with somebody who was sick with coronavirus and having to self-isolate for 2 weeks. How many substitute teachers are we going to go through if every time somebody is exposed to coronavirus at school, they've got to self-isolate for 2 weeks? I don't know if we've thought that through. And my guess is no. Because every time we pose one of these questions, we find out that the answer is, well, follow medical advice, which means either we don't know the answer to that, or I don't want to say the answer to that because that's going to panic everybody, because the answer is, we don't know. We'll see what happens. And that's not very satisfying when it comes to making decisions about sending your kids back to school. All right, let's see. Speaking of, as we were earlier, about the number of places that are going to be as bad as New York. Let's see. All you have to do is turn your head and look at what's happening on Twitter immediately, and you'll see something. Let's see. There's Reed Wilson, just really as a random example. Reed Wilson tweeting, hospitalizations exploding in Georgia. Emory Healthcare's COVID-19 patients tripled in 2 weeks. You can read all about it at the Atlanta Journal-Constitution. Or you could turn your attention over to here to what I had socked away in pocket from yesterday. The Mississippi Free Press. Mississippi hospitals cannot take care of Mississippi patients. 5 ICUs full as virus booms, says Ashton Pittman for the Mississippi Free Press. Want the details? Don't worry about it. We don't have time for the details. We'll just point out to you. Arizona, Texas, Florida, Mississippi, Georgia, Arkansas, camps in Missouri. Remember when warm weather was going to kill all of them? Yeah, all right. Well, all of them now waking up to news articles that we could be worse than New York. Of course, there will be doubters, and there'll be statistical games being played. Are they worse than New York? Some people will say, I don't know. What were the numbers for New York? We can actually go and check that. Deaths. 32,000 deaths in New York. We're Arkansas. We're not going to have 32,000 deaths. Of course, the important thing would be deaths per million in population would be the fairest way of actually comparing these things. But whether people will settle for those statistical games or not, I don't know. But we look, in the middle of all this thing, in the middle of all these claims that all these various hospital systems are overwhelmed, it's still extraordinarily popular on Twitter to tweet the Film Your Hospitals hashtag. I went by the hospital and I filmed the front door and it was empty. And it's because, of course, again, they typically keeping the patients indoors in modern medicine. But people still doing it, and people still insisting that it's a manufactured virus and the cure is, somewhere. And President Trump will kick the door in a lab in China and machine gun everybody and bring it back with him and save us all and resurrect the dead as well. I don't know. All right, let's see. We'll make one more quick scan here, but no, I think we've probably hit all of the necessary coronavirus news that we can fit in here. We have to turn our attention, of course, to something different, because eventually we run out of coronavirus stories, I suppose. There is one more that I wanted to bring up. I happened to capture the tweet of Ryan, is it Struyk or Strike? Struyk, CNN reporter, who tweeted this yesterday. This was new to me today, which was yesterday. Dr. Fauci says there may be a, quote, post-viral syndrome associated with COVID-19 in which fatigue can incapacitate people for weeks and weeks following so-called recovery and clearing of the virus, and that people really do not get back to normal. So some of the now 1.5 million people that we count as having recovered from the virus, meaning still living, but the virus no longer detectable in their bloodstream, and maybe antibodies, maybe not antibodies, but no more live virus on them, they count as recovered. But if they are suffering from a post-viral fatigue syndrome that keeps them incapacitated for weeks and weeks after they're so-called better, as the virus magically disappears from their body, as the president puts it, how much better is that than being incapacitated in bed for weeks and weeks with the virus in you? Not much better. Not very good news for productivity reports, I don't think, either. We'll be right back to wind this up and head into other directions. Hi, everybody. It's me, David. Let's change things up from the old fundraising pitch for just a minute and talk instead about how you can be a part of our show. If you've got a smartphone or any other electronic recording device, why not sit down and record a segment for us? Read us an important article and give us your take. Read one of your own original essays, or even just give us your commentary on something you'd like to share that's important to you. Then send the file to me at kagrox@gmail.com, and I'll try and work it into the show. Short segments, a few minutes in length, are easiest to fit in. And of course, I can't always guarantee that I'll be able to play everything, but if you've ever shouted at your radio or TV about something you wish was being covered, here's your chance to change that. Make the show your own. Send your submissions to me at kagrox@gmail.com. Okay, welcome back now to the Kagro in the Morning Show here on Netroots Radio. We do have to shift some gears to discuss in somewhat more in depth, and we've really been neglecting it because it happened yesterday during our show that the Supreme Court decisions were issued, and we only got sort of a brief inkling of what they might have been about. I'll share with you, though, what Joan McCarter put together right after the fact on Daily Kos's front page yesterday. I probably should scan for new updates, but this was her immediate reaction. Trump loses twice in Supreme Court on financial records cases, but can keep fighting in lower courts. And there's a lot of differing opinions about what these differing opinions meant yesterday, and I think the headline captures it both. On the one hand, it's true that the rulings were in some ways adverse for Trump. Both rulings held out at least the possibility that he could, in the end, lose in substance on these cases. But the key, really, to doing what Trump wanted to do in all this is in the second half, he can keep fighting in the lower courts. In other words, kind of what we've been saying all along on the show when we've kept an eye on these oversight and subpoena cases, that it was always the intention of the Trump administration not necessarily to win the cases outright, but to be able to continue to drag their feet and not comply with the demands for information. So, I guess they get to continue to execute that plan. Joan put it this way. In two 7-2 decisions written by Chief Justice John Roberts, the Supreme Court ruled Thursday that Donald Trump does not have categorical immunity to withhold his financial records in a criminal investigation, nor can he withhold them from Congress. Both cases, though, were sent back to lower courts for proceedings and are not immediate victories against Trump, which is really all he's worried about, just that it not be immediate. Except for the part where his boys Neil Gorsuch and Brett Kavanaugh agreed that he's not the king. Ouch. We'll see how ouchy that really is once Joe Biden is president, though. That's where the ouch will be applied, I think. Presidents from Monroe to Clinton have accepted Marshall's ruling that the chief executive is subject to subpoena and have uniformly agreed to testify when called on in criminal proceedings, Roberts wrote in the Vance case, in which a New York grand jury had subpoenaed Trump's records. Roberts held that the subpoena can be enforced as long as it doesn't interfere with Trump's constitutional duties, meaning Trump will have to come up with an argument other than presidential immunity in the lower courts to block the subpoena. Article 2 and the Supremacy Clause do not categorically preclude or require a heightened standard for the issuance of state criminal subpoenas to a sitting president, Roberts concluded. So, in other words, they'll have to argue in court that the subpoenas pose some undue burden on the president, who is too busy to have to deal with criminal proceedings, or that it would impose some undue burden on the fulfillment of national security roles by the president or something of that nature, or that there's some clash perhaps between the separated powers of the judicial branch and the executive branch, even though they would be as between the state judicial branch and, well, I guess also the state executive branch and the national, federal executive branch. That might change things a little bit. Of course, for this president to argue with a straight face that he's too busy or is too consumed with the execution of national security roles when he does nothing but watch television and play golf, and when he does that, he's apparently, according to admissions from the White House, unavailable for a national security situation for hours at a time because he's too busy with the golfing and has put his phone down, whatever that's supposed to mean. But that doesn't mean he won't make those arguments. They just might be facially invalid, but courts will likely take the opportunity to rule with other presidents in mind, as they should. They should consider what's going to happen with others. And he'll be the beneficiary, once again, of other people's work. The fact that most presidents pay attention to what they're supposed to be doing and actually serve their national security functions will be used to say, well, we can't just individualize it based on this guy, but you really could. I mean, why not? Why not just do that and then issue the warning as they did with Bush v. Gore? Well, this doesn't have any precedential value, except insofar as you might be judging the case of another idiotic, wastrel president in the future. And by all indications, we're going to be dealing with a lot of idiotic wastrels in the future, some of whom will be president. Roberts held that the subpoena can be enforced as long as it doesn't interfere with Trump's constitutional duties, right, whatever those may be. The justices also agreed with House Democrats that Congress has the power to subpoena the president's financial records, but ruled that lower courts must, quote, take adequate account of the separation of powers principles at stake, including both the significant legislative interests of Congress and the unique position of the president. That's the end of the quote. In essence, this punts the matter back by sending it back to the lower courts for further consideration. In practice, the decision means that the House is unlikely to get the Trump's tax returns before the election, or anything else for that matter, that's ever requested in the future, because presidents will litigate this until they're out of office, essentially. You'll never end up being able to enforce a subpoena, certainly not in time for Congress to be able to do anything effective with it before that president leaves office. The subpoena processes in both the New York case and the congressional case will continue, but the subpoenas will not be enforced immediately. This will allow Trump to continue to fight, and it likely will mean these records aren't available until he's no longer president. However, it means Trump's claim of absolute executive immunity has been rejected by everyone on the Supreme Court except Clarence Thomas and Samuel Alito. So that's kind of an important point, too, although it's never good news that two justices of the Supreme Court who may or may not continue to serve for who knows how long, or will likely be replaced by people who also believe this. There's probably going to remain, no matter what happens, 2 votes on the Supreme Court for the idea that the president is absolutely immune from prosecution and subpoena process for any reason, unless, of course, it turns out that he's a Democrat, in which case we'll change our votes. That's bad news, but there's very little that we can do about it, short of, impeaching them and removing them from the Supreme Court, which, not likely to happen. But hey, if you could get yourself a supermajority of 67 senators and they would all listen to me, then we could get it done. But that's not happening either, even if we get the 67. Okay. Just thought I'd bring that up. Oh, I just happened to see another coronavirus tweet happen by and say, so a stupid thing. Talking Points memo tweeting the story of the Alabama GOP leader who says he wants more COVID-19 cases in order to build immunity, which isn't happening, as we spent a good deal of time explaining, and certainly isn't coming without a huge price. I really don't know why. We should change the name of herd immunity, because what it really is, of course, is what's left of the herd immunity. In other words, I guess it's the old what doesn't kill me makes me stronger. People use that as sort of funny or tongue-in-cheek kind of expression, writing out of it the danger of the first part. What doesn't kill me? Well, what might kill you might make you stronger if you happen to survive it. But if it does kill you, then it's not interesting. You never get to say it. Well, what doesn't kill me makes me... clunk, boom. That guy just died. What doesn't kill you makes you what? We'll never know. Only people who survive or who never were in danger in the first place get to say things like, what doesn't kill me makes me stronger. Oh, well, yeah. So, survivor's immunity. I don't know. I have to come up with some new term so that people aren't quite so attracted to the idea of herd immunity. Somehow herd doesn't carry the bad news properly. All right. Well, that's, I thought was that's a good summation from Joan. Actually, I feel like checking in on the front page and scrolling through in order to see whether we're missing anything in particular, but certainly maybe some new thoughts about what happened there. Yes. Also interesting, more developments in the story of Lieutenant Colonel Alexander Vindman. Good headline here from Mark Sumner reminding us exactly what it was that they used to try to keep him from advancing. He's retiring from the Army, having concluded that his career is over now that the president has taken a personal interest in blocking his advancement. And I guess, I don't know what's up with Tammy Duckworth's continuing hold on the other advancements, but maybe they've given up on that. Not sure. But Mark Sumner noting Trump ordered officials to find some reason to deny Vindman's promotion. They found nothing, but his orders to the brass at the Pentagon and I guess the civilian leadership of the Department of the Army, I want you to scour his records and see if we can find a reason to prevent his promotion. And when they couldn't, he just said, well, I'm preventing it anyway. I was hoping for a reason, but I don't have one, so I'm just blocking it for no reason. And out goes Vindman. All right, let's see. Was there more, though, on the decisions from the Supreme Court? There we've got some different ones. So there was another big decision there yesterday that Joan also covered. Supreme Court rejects Oklahoma's effort to nullify promises made in the name of the United States to tribes. That we noticed that Ted Cruz was reacting to with the, oh my gosh, can you believe it? The Supreme Court just gave away half of Oklahoma to the Indian tribes. But of course, as it turns out, they were merely interpreting a treaty in which the land belonged to them in the first place. So it wasn't so much of a giveaway as a recognition of the value of the treaty contract that which is next to nothing, but that they at least once had with the United States. That was sort of surprising because I thought we had given up on honoring the treaties, even when it's really clear exactly what's going on. Other courtroom news. Mark Sumner also happened to have caught this story. Judge Sullivan isn't done with Flynn just yet. Case is going to the full Court of Appeals. Yes, Sullivan, the trial court judge in Flynn's not espionage case, but should have been, has, as you know, not agreed to accept the Justice Department's plea that the charges ought to be dropped against Flynn. Now that they were just about to go into the sentencing phase, there was a decision of the D.C. Circuit Court of Appeals that sought to enforce a writ of mandamus against Judge Sullivan, forcing him to accept the DOJ's position and drop the case. And he has appealed that, looking for an unbank, we should say, rehearing of the case, which would likely reverse it. And as it turns out, it was up to him to request it. He has made that request, and we'll see. It is yet to be determined whether the court will sit for review. We hope so. But again, it's another one of those situations where everything takes forever, and it always works to the advantage of the criminals in the Trump administration to just drag their feet, as it did with the Bush administration before them. there's very little that you can do about it. If, for instance, at least in the case of the congressional subpoenas, they just continue to want to approach things really in the most milquetoast possible manner. I don't see anything on the Daily Kos front page that, I guess I'll scroll back a little bit more to see whether there's any more analysis of the cases. And I guess I will say this here: we certainly miss having Armando available to discuss the things. And I will say that there's no rule against his participation. I think we were just trying to kind of honor the settlement which had brought peace to the realm, at least briefly, during the end of the primary period. We're not entirely settled there yet, but I will state once again, as we did for the impeachment issue, this is a fairly important issue. If the phone were to ring, the rules are I answer it. I don't know who's on the other end, except for the part about up on my computer screen that tells me that it would be Armando. But if I close my eyes, would I know the difference? And the answer is no. I think also we should have lodged a protest against cancel culture. Isn't that the hot thing to do now? That was what was going on with the letter, that everybody's now canceling the letter, of course. But and in fact, I did see a fairly interesting item about that. We'll see if we can get around to that before we close things out. But for the most part, I have not much more actually to add to the outcome of those Supreme Court cases. It's always been my suspicion that it wouldn't matter even if the Supreme Court ruled directly against Trump and sought to enforce the subpoenas immediately, because he would simply say, I'm just not going to do it. I'm not going to comply with the law, and I know that there's not very much that you can do about it. That, of course, brings us immediately to constitutional crisis. The thing about constitutional crises is that they don't have to be resolved. They can just loom forever, either until the president leaves office, dies, or presumably is arrested or overthrown in a coup of some kind, and nobody wants to see that sort of thing happen. So you could basically just sit there forever with the president saying, I'm not complying. I'm not. And unless you're going to send marshals to, federal marshals to try to arrest me and have a gun battle with the Secret Service, if they remain, for whatever reason, convinced that they need to protect this president. It may very well be that a constitutional crisis convinces them to say, well, we're going to have to pick a side, and neither one looks particularly good for us in terms of staying apolitical. So it's political on one side or political on the other. Maybe the thing to do instead of having a gun battle is not having a gun battle. That's usually, that'd be a net plus, right? And if they arrest the president and everything otherwise checks out legally, but all we did was decide we should abandon our protective role for today, I suppose somebody could sue us, but who would do that? The president? He's under arrest. Somebody else? Do they have standing? One might ask. We don't know. The courts would say no. They may very well find out that the path of least resistance is to simply say, what can we do? Well, what if they start arresting every president? I don't know. Does it really matter? Isn't it just as apolitical to say, I'm not going to stand in the way of this arrest, as it is to say, yes, I will? I don't know. At any rate, none of that likely to happen, but it brings us back to where we were in, 2005, 2006, when I said, these court cases can drag on forever. There is nothing preventing a president from simply saying that either doesn't apply to me, or even if it does, I'm not going to do it. And unless somebody's going to show up and try to arrest the guy, nothing's going to change. And so we came to the conclusion that ultimately subpoena power in the Congress really depended on, for its life, on being a proxy for inherent contempt. Either you give us the answers we want, or we will arrest and imprison you and, I guess, essentially depose you from power. But since you really will never be able, probably not going to be able to convince, you can't even convince Democrats of good standing, like the chairman of the Ways and Means Committee, Richard Neal, to use power that's granted to them in black and white by statute to get those taxes and the tax returns from the IRS. Imagine trying to get a vote on inherent contempt in which you're going to arrest, I don't know, whether it be the attorney general or the president himself or anybody, even a lower level functionary inside some department somewhere. They're not going to use their inherent contempt powers without, retching and vomiting first. Not to mention, who knows what sort of vote it would take to then, if you were to arrest the president, then what? You declare the presidency vacant? How many votes would that take? No chance that anybody's going to do anything quite like that. That being the case, you're stuck with this. So far, you've never really been able to enforce a subpoena against the president or anybody that the president wants to declare comes under his umbrella of immunity. The courts have now said that umbrella is stupid. It doesn't exist. But where are the papers? Where's the information? Where's the testimony? Where are the people? They're nowhere. They're still walking around. And we're going to have the lower courts are going to reconsider. And if you read what Joan had to say, what Joan quoted in the case, let's see. Let me see if I can scroll down to where it was. Yes, right. Article 2 and the Supremacy Clause do not categorically preclude or require a heightened standard for the issuance of criminal subpoena to a sitting president. And then, of course, that's the criminal case. With respect to Congress, the lower courts, which are now to consider this, are supposed to do so in light of the separation of powers principles at stake, whatever that means. And it's very vague, and no one knows what it means. But it's supposed to be, I think, a heavy-handed hint to the courts. If you decided earlier that the president was subject to subpoena by Congress, I want you to reconsider that. That's a pretty strong hint all by itself. And I want you to reconsider it in light of separation of powers issues. I mean, come on. Do you think that they didn't consider it in that light? What other light is there to consider it in? Of course you consider it in light of the separation of powers principles and the significant legislative interests of Congress and the unique position of the president. Nobody needed to remind the federal courts that the president, there's only one of them, and that Congress has significant legislative interests. It's not going to change anything. It's a heavy-handed hint, but also an abdication of, the responsibility for saying, I'm an authoritarian and I'm upholding an authoritarian and executive supremacist view of how to resolve these issues. As we put it on this show all the time, the irresistible force versus the immovable object. We're going to resolve these cases every time in favor of, I don't know which metaphor fits best. Is Trump the immovable object or is he the irresistible force? I'm sure he'd rather be irresistible, right? But anyway, no, I think he probably more resembles the immovable object. I think, just physically speaking. Anyway, doesn't matter which role you assign him. They're just going to decide it in favor of the presidency, always. And the more competent the president, the more likely that they would otherwise decide in their favor anyway. Unless, of course, he's a Democrat, in which case, and faces a Republican Congress. That they will be perfectly happy to undo. Let's see. Mike Musson has this comment here. The necessary reform will be expedite or prioritize all proceedings against the president over anything else. Make the court run fast enough that delay is not effective. Otherwise, the legal matter could weigh on the president and affect his mornings in bed tweeting. That's an interesting approach to it. I don't know whether you would be able to convince dedicated ideologues from the other side to accept it, but that's a good idea, right? In order to facilitate the president's necessary role in national security and other important constitutional issues, we have to move this case as quickly as possible rather than delay it as long as possible. We'll see whether that works for anybody. But what essentially it comes down to is you're stuck with inherent contempt as your only weapon, and you wouldn't have to necessarily, ideally, you wouldn't have to exercise it that many times. Just once should do it, just to remind you that apparently subpoena power relies on this rather than on the rule of law and our federal court system, because that doesn't appear to work. They keep ruling in favor of it, but also saying, take your time, take another 2 years to decide this thing. And, you know, with 2 4-year terms built into the presidency as a limitation, you can easily litigate your way all the way through it and then just defy the whole thing if the only answer to the defiance is inherent contempt, or I suppose a court could hold you in contempt. And I guess we're more attuned to believing that that's a legitimate contempt power than inherent contempt, but it doesn't do anything for our separation of powers game. And if they're the ones saying that, if the courts are the ones saying that particular care has to be paid to separation of powers, they're less likely, I would guess, to resort to their contempt powers, which are also inherent, by the way, in order to enforce a subpoena. So basically, if they're unwilling to exercise that inherent contempt power, there's no subpoena power. And I told you that in 2006, and some believed it, some didn't. And we're back where we started. I was right, but I didn't win anything. Get it? That's probably like most of life at this point. All right, let's see. Other items that we might be able to shoehorn in here before exiting for the day, or at least handing things off to Justice Putnam for his take on the happenings of the day. Let's see. Yeah, that's covered already. I don't think that's going to add too much to our analysis. I had another tweet set aside, but I think we've kind of covered that topic. Let's see. I'm going to quickly scroll down a little bit lower in Pocket and see if we can't bring up a few items that have been hidden under the weight of other stories that might help you with things. Yes. Well, here's sort of an interesting one for the conspiracy-minded among you. I just thought I'd include this. It's a good thing for a Friday when you only have a couple of minutes left. The Independent over in the UK reporting just a couple of days ago on I guess now that our attention is turned back to Jeffrey Epstein with the arrest of, still don't know how to say her first name. Is it Ghislaine? Is it pronounced some other way? It's what it looks like. Maxwell, now under arrest. You might be interested in this line. Deutsche Bank, and you know, they're very, really a paragon of integrity over at Deutsche Bank. Deutsche Bank fined $150 million. Not that they care about that pocket change. After Epstein used dozens of accounts to pay off victims and alleged conspirators. It's nice to see that they would pay some price for that. The German lender failed to properly monitor account activity conducted on behalf of the registered sex offender, New York regulators say. Another New York case. Chris Riotta writing for the UK's Independent in this case. Deutsche Bank has been hit with a $150 million penalty. As part of a settlement, the German lender signed with New York regulators for violating anti-money laundering rules in its controversial relationship with billionaire pedophile Jeffrey Epstein. And it is a British paper, so P-A-E-D-O, pedophile. Epstein, the disgraced billionaire who killed himself last year in federal custody while awaiting trial on sex trafficking charges, used his accounts with the bank to pay off co-conspirators, lawyers, and even victims, according to New York Department of Financial Services. Where did they draw the check for Stormy Daniels from? I'm not sure. That wasn't, of course, illegal sex trafficking. Just a question. I'm not sure who they used for that account. Anyway, I guess it was Michael Cohen's originally. Anyhow, the bank failed to properly monitor account activity and was conducted on behalf of the registered sex offender. Despite ample information that was publicly available concerning the circumstances surrounding Mr. Epstein's earlier criminal misconduct, the department said in a statement, regulators also noted very few problematic transactions were ever questioned by the bank, adding, and even when they were usually cleared without satisfactory explanation. It should come as no surprise to you that, gee whiz, Deutsche Bank, which also has this weird relationship with Donald Trump, happens to also have a weird relationship with Jeffrey Epstein and was not doing their job to detect money laundering and other illegal activities. No surprise, really, except for the fact that the other guy for which they perform this function remains as allegedly President of the United States of America. Gee whiz. All right, well, time now to hand things over to Justice Putnam for the West Coast Cookbook and Speakeasy. I can't imagine what in the world we didn't cover that he might, except for everything. Let's give you a sampling of what's coming up. In a rare display of surprising cognitive abilities, rarely displayed at the White House, the SCOTUS decisions were either a witch hunt and a hoax or a big win. Take your pick, I guess. On the rest of the menu, worker advocacy groups filed a civil rights complaint alleging meat processing companies have engaged in racial discrimination during the pandemic. 5 coronavirus vaccine makers will testify before a House subcommittee later this month. And a Texas state judge refused to do what? I'll tell you after this.
From Daily Kos Radio on networksradio.com. You have been listening to the Kagro in the Morning Show.
With David Waltman.
Now, you probably guessed that Texas state judge refused to order Houston to hold the Texas Republican Convention in violation of pandemic mandates. After the break, he moves on to Chef's Table, where former Liberian President Ellen Johnson Sirleaf and former New Zealand Prime Minister Helen Clark head to the WHO COVID panel.